Hey there. I am Dr. Corey Howard here for another episode of Live Beyond Well. I'm a practicing physician, internal medicine, gastroenterology, anti-aging, functional regenerative medicine in practice for 28 years. And so I see patients every single day, always getting questions about supplements. Specifically, we're going to talk about magnesium and the reason why it's so incredibly vital for you. Now, there are literally over 300 different functions of this little element, and so therefore you need to make sure that you have it. Now, I've chosen to actually put some slides in with what I do. A lot of times information, I think that if you can see it visually and you're going to listen to it, say on a podcast, you can always go back, take a look, download the slides if you want to, print them out, whatever makes sense for you. But sometimes it's hard just in a single simple podcast to get all the information. So this is information that you literally can utilize as soon as you look at this and then apply it to yourself. Now, when you're looking at magnesium, there are a whole lot of functions. And you say, well, I've got some magnesium, exactly what it does. So energy production. Well, energy production, muscle nerve function, bone health, heart health, you can see it right there, blood sugar control, protein synthesis, and nervous system regulation. So let's talk about energy production. Energy production has to do with my favorite nuclear power plant of the cell called the mitochondria. The mitochondria is where all your protein, fats, and carbohydrates, your macronutrients, and if you want to know more about macronutrients, you can check out our podcast on YouTube. Now, what they do is it enters into the system, and with magnesium as part of what's called a cofactor, which is like a key to a reaction that occurs in the human body, basically is able to then create ATP or energy. So that's where energy production comes into it. In terms of muscle and nerve function, well, it plays a role there because it helps to regulate your contractions and actually has something to do with your neurotransmitters, which are the compounds that go in between your nerves to make them work. And so you can think of your nervous system kind of like a telegraph line, or say a power line. And so on the power line, there's just not one continuous power line from one part of the United States to the other part, right? Every so often, there's a station, a transfer station, so to speak, in which case energy is then stored and then re-released. And so a nerve cell has a kind of a similar mechanism where it goes and it's electrical, and then it's chemical, and then it's electrical again. So the transfer station is actually in a chemical kind of standpoint, and we can talk about that later. In terms of bone health includes magnesium, which actually helps calcium and vitamin D keep the bones strong. But here's an interesting fact. 60% of your magnesium in your body is in your bones. And so healthy bones means that you can not fracture easily, but you also have a source of some calcium, magnesium, and vitamin D. Now, the problem here, of course, is that if you have problems with your bones and you leach out your magnesium, that could be an issue, and that would be a disease entity that we could talk about at a later date. Next is heart health. Now, magnesium helps really regulate the rhythm of the heart, which is really important, as well as making sure that it decreases potentially the risk of heart disease. In blood sugar control, it actually helps with insulin receptor as well as metabolism. And so that really helps out how glucose, insulin interact and what happens to that. So it can actually reduce potentially type 2 diabetes, or at least help you regulate it a little bit more. So if you're somebody that has diabetes, I'm not saying, well, take magnesium and your diabetes will go away, because that would not be correct. But it can help improve your symptoms. And of course, the number one thing with type 2 diabetes is if you're overweight is to lose weight. And that would be number one. And in fact, when we get into inflammation on a different podcast, we're going to talk about how inflammation regulates a lot of disease entities and causes a lot of problems. Now, protein synthesis is exceptionally important because magnesium helps with that process. Protein synthesis is basically making of proteins. So it's not like you eat protein and then you have protein in the human body, that is actually not what happens. What happens is that you eat protein or have a protein drink, and sometimes the amino acids are already broken down. There are 20 of those. And what happens is that your body then figures out which amino acids need to go where in order to make a protein, because proteins are a combination of these amino acids in strings of different sizes. And the last thing is nervous system regulation, which really helps, again, with the neurotransmitters. So you can see that magnesium is really important for this. And I would say energy production is, for me, number one in really helping to understand it. Now, the next thing that we have are the sources. And so you say, well, how much magnesium can I actually get in my diet? Well, it depends on what you eat. And so if you take a look at this list, I mean, these are mostly healthy, whole food products, from green leafy vegetables to nuts and seeds to legumes and fish, avocados, bananas, chocolate, tofu, and dairy products. But each one has a little bit different spin. For example, like if you have a cup of spinach, that's about 157 milligrams of magnesium. You probably need 400 to almost 800 per day, just depending. Could be more depending on your exercise routine. So if you're somebody that exercises a lot, you need a lot more energy produced. You need to have more magnesium present. Nuts and seeds have a varying amount. And basically, you're looking at around 80 to 150 milligrams. Interesting point. What's coming up? Halloween. What's associated with Halloween? Pumpkins. What's in pumpkins? Pumpkin seeds. Very good. So pumpkin seeds are actually 150 milligrams per serving. Now that would be an ounce. So not like an entire bag of pumpkin seeds, because, more does not mean better. Now, whole grains, brown rice, quinoa, products like that really have about 100 to 120 milligrams per serving. And that would be approximately a cup or so. Now, let's go to fish, because a lot of people, who are on protein-heavy diets with animal products, hopefully eat some fish as well. Now, fish, a 2 or 3 ounce piece of fish, which is pretty small, actually only has about 80 milligrams of magnesium. So not a lot. Bananas have a little bit less. So a medium-sized banana is like about 30. Avocados have around 70 or so. Tofu, again, pretty small. And dairy, around 40. So you can see that if you ate several of these foods in a day, that you would actually be able to get enough magnesium. So before I get into the types of magnesium, which is the mainstay of what we're going to talk about, you may say, well, how would I even know if I need some magnesium? And so that goes to the types of magnesium and what their uses are. Because you can see from this, I'm going to show you 11 different types of magnesium. That's right, 11. And you're like, wow, that seems like a lot of different types of magnesium. How would I even possibly navigate this? And that's the question that I get all the time. So there's a couple of go-tos for me. I mean, I have a few that I say, this one is the one that I really, really like as a starting point, depending on what you're doing. And so first here is you got magnesium citrate. Magnesium citrate will help you go to the bathroom. That's right. Help you go poopy. Now, the problem here is that, for people that have constipation and needing some extra magnesium, they may go for this. I would use this only if you had constipation. I would not use this as the primary magnesium source if I'm trying to help you with magnesium levels or just improve some of the functionality of what magnesium can do, such as cramping and stuff. So I'm going to talk about that. Magnesium oxide is basically used for heartburn. It's also used for constipation, but I really don't go for this one. And you can see the amounts of each on here. 250 to 500 milligrams is what we have listed. The one, my go-to, is magnesium glycinate. So when I'm talking about magnesiums, one of the things that's really going to be important is how well is the product that you're taking going to be absorbed. That's called bioavailability, how it gets absorbed and it can do its thing. And so in this particular instance, magnesium glycinate has a very high bioavailability, very well tolerated, low GI side effects, and it's for some of the most common problems. So if you have trouble sleeping, it helps with that. If you have cramps at night, it helps with that. If you have fibromyalgia, which is a chronic pain syndrome that people can get, it might help with that as well. It can also help with anxiety at night. Now, obviously, you want to address each one of those individually if you're a patient, because you want to see, well, is there something else? Are you not sleeping because you're drinking 19 cups of coffee in the day? Or did you just exercise before you went to sleep? For you. I mean, some people do well with nighttime exercise, some people don't. And so it's really important to identify what the exact problem is and what you're treating it. Magnesium malate, this is one for energy, chronic fatigue, and fibromyalgia as well. But the next one that I really like is magnesium L-threonate. Now, why is that? Because that particular one is good for cognition and memory. It's really the only one that's listed specifically for that, and it has something to do with the L-threonate component and how it gets absorbed. And so this is a very important one. You can see the amounts are a little bit different, 1,000 to 2,000 milligrams for that particular one. So you may start to say, well, you're showing me all of these different magnesiums, and so how can you combine them and things like that? And I'm going to get to that. And so also you have magnesium sulfate, which is like Epsom salt. You soak in that, and it's good for aches and pains, but doesn't really dramatically increase your magnesium levels. Next, we have magnesium chloride, which is really used for magnesium deficiency. So if you were come in the hospital, you have very low magnesium, how would I know? Generally, your potassium is going to be low because magnesium is necessary in order for you to get potassium into your cells. And so if you have low potassium, you need to replace with magnesium. And that is why when you use these electrolyte replacement solutions, say you're exercising and you're in Florida and you're sweating like crazy and losing, a liter an hour, well, you're going to be losing magnesium as well. And it's hard for these formulas that have sodium and potassium as the primary thing and not much magnesium, is you can't get that potassium into the cell. So you need to have magnesium to do that. But I wouldn't do it in magnesium chloride. I would do it in a formulation that you can drink. Magnesium taurate is used for heart health. And when I looked up, looking to determine, taurate and malate and aspartate and all these different products, it turns out that each one of them has a little bit additional component in how the magnesium is absorbed. So ultimately, magnesium taurate, aspartate, and aspartate, and carbonate and orotate are all slightly different. Magnesium carbonate is for heartburn again, and so that would be in forms of like Tums, calcium carbonate kind of thing. In this case, it's magnesium. And magnesium orotate. So you have all these different ones, and you're thinking, well, again, I have all these. What do I do? Remember, glycinate and L-threonate are two of the biggest and best ones in terms of what we want to do, but I probably wouldn't take them at the same time, although I will show you some products that are combined. The next question that I also often get asked is, what brand should I use? So, I'm not one of those that have everything branded, Dr. Howard's best brand, so I can just sell it to you, although I do recommend certain brands. But I don't have any significant cost sharing with most of them. Some I think are better than others, and I do actually have them in the office or recommend them online. But products like Thorne, very common. Most of these are on things like Amazon, very easy to get. Pure Encapsulations, probably my favorite brand. Doctor's Best, I don't really use that. It just depends. Nature's Made, I usually stay away from. You can get that on the shelf of your grocery store, but it's one. Now Foods is listed as non-GMO, more natural product. And then Life Extension, which is a pretty good brand overall. But when you're looking at these, you have to ask yourself, well, what is the reputation? What kind of certifications do they have? And what does that even mean? So that really goes to, well, how do I choose one of these products, right? So here's the way that you look at it, besides me telling you which ones are good, right? So I'm not going to tell you, you should only use this because, I want to make sure that as a consumer, you're making your own choices. But as a physician, I'm giving you some guidance. But I'm certainly not just telling you this is the only brand that you have to take. So purity and safety, absorption or bioavailability, which we talked about, label transparency, which is, do they really have inside what they say they have? Meaning that the testing has to be done and the actual product has what they say. Because believe it or not, some products don't. Certifications and testing, and efficacy, meaning does it work? And so when we're looking at this, we've got purity and safety really. And so high quality brands really are free of contaminants or more pure products. Absorption and bioavailability, does it get absorbed well? So it depends on the vehicle that it's in. Label transparency and certifications and testing. Well, there's basically NSF, which is the National Sanitation Foundation, USP, which is United States Pharmacopedia, GMP, which is Good Manufacturing Practices. And those three are kind of like the guidelines for what they do. The GMP is really regulated by the FDA, the Food and Drug Administration, onto making sure the products have what they have or what they say they have in them. So looking at that, I would be very careful when you pick something online. If you're looking only at the price, please do yourself a favor and take a look at, do they have these certifications? Have they been tested? And are they a good brand? Or you can look at a product and has, 27,000 4.9s, and, that could help you as well, but isn't always correct. So you want to make sure that you're actually diving into it a little bit. And so, these are just some of the products that I mentioned. The one that is very interesting here is this organics product, because it says it is the most complete magnesium product on the market because it has like literally 7 different kinds of magnesium in it. And I have to wonder, is that really better or not? Because I think that if you are replenishing your magnesium correctly, I would probably focus on magnesium glycinate, number 1, and magnesium L-threonate, number 2. And the combination, so I'd probably take magnesium glycinate at night, and in the morning, or sometime with your first meal, I would take magnesium L-threonate. And so that would be my preference. But again, you've got products that are all combined, and I can't really tell you if they're better or not. I haven't tested them myself, but they sound interesting, but I'm not so sure that that's exactly the right thing to do. I might just start with one. And so if I started with one to handle some of the most common problems that people have, which is insomnia and cramps at night, like your foot cramp, or, you just kind of have aches and pains, or you're kind of one of those like toss and turn all night long people, the magnesium product could be very beneficial. In terms of the dosing, I particularly like the brand Pure Encapsulation. So that particular brand, it comes as a 120 milligram capsule, and I would start with 2 at night. And in the morning, I would probably take 500 milligrams of magnesium L-threonate, and then maybe another 500 later in the day if you want. But again, I would start with just one type, not a combination pill, and just to see how it helps you. Now, I do want to dive into what that can do at night, especially the magnesium glycinate taken at night, because the reality is we are all decked out with different devices frequently. And so I happen to like an Oura Ring and a Garmin watch, but you can choose a Fitbit or any other brand that you would like. And I just like these because they give you some information and insight into your sleep patterns. And what I noticed is that a lot of times, and me included, I have not enough deep sleep. So why is deep sleep so important? Well, if you think of it like this, every single cell of the human body is like a mini city. So what happens in a city? People go to work, they come and they're making their food, they're generating energy and then garbage, and they're all hustling and bustling all over the place, hopefully creating something. And at the end of the day, what happens? Well, everybody finally leaves, and you've got to get rid of the garbage, and you've got to replenish all the stores of the things that got used up. So if you're, say, a restaurant, you've got to buy everything again and then start again. Same exact thing happens in the human body in every single cell. And deep sleep is when all that happens, the cleanup period. And so you really can't replenish yourself and get restorative type sleep if you don't have enough deep sleep. And magnesium might be able to help with that, specifically magnesium glycinate. So there are 11 different kinds of magnesium products. Very difficult to choose. Start with one. Personally, magnesium glycinate is a go-to. Pure Encapsulations is a good brand, but you can choose whatever you want. But always check with your physician if you can. If you don't have one, there's lots of information online, but do your research. I'm Dr. Corey Howard, here to talk a little bit about magnesium. If you do have questions, you can always click below and we can answer those for you. Thank you.